Amelia's Ward Linden. It's the mall that has it all. We have great food, a relaxing atmosphere, and activities for all ages. Tennis, swimming, and a playground. But the fun doesn't stop after dark. There's even a bar and an arcade. And if you aren't ready to go home yet, we've even got a spacious room for your comfort, complete with air conditioning, Wi-Fi, and a private bathroom. The Toucan Mall can also facilitate your event in our spacious conference hall. We also have a theater with films for the entire family. It's the Toucan Mall located in Amelia's Ward, Linden.
A very good evening to all of my friends and relatives and well-wishers and those of you who are waiting on our program to get started. Well, once again, we are having our program um, remotely. It's not going to be, it's live, however, it's by remote. So we are having slight different arrangements with the phone calls and answering the questions and everything else. But technology is so good today that we can still do this program even though I'm locked away someplace and can't be in the studio because of quarantine and restrictions and all sorts of things. You know, we don't know how long this is going to occur for, but call your friends and your buddies and your families and let them know that the program is on, and we're going to have it on live every Thursday until we can, well, it's normally live for the most part, but we're going to have it done this way every Thursday until we can have situations return to normalcy, right? You notice I'm saying situations, okay? I'm not using certain words, right? Because I don't want you to be fearful of what we're experiencing here. That's that's taking the lives of people and causing them to be hospitalized and all of that. But I was thinking today. I was really thinking today. I my brain is really working hard. I wondered if we were to examine in every country around the world. I know some of the numbers are really extravagant, okay? How many persons do really die every day in countries? You know, if it's, let's just say that this thing is not existent. How many persons really die every day in countries? Let us examine that and see and compare it to incidents and to other situations in the past and see really what is going on. This is some strange stuff that's happening here, and my brain doesn't stop thinking all the time. Even when I sleep, I'm thinking. I am trying to understand really what is the purpose of all of this, and I'm trying to put in places some statistics, right? We know that every day people are born and every day people die. What we're having now may be a larger number of persons dying because of certain things that are happening, okay? But I am certain that in most countries, the average death in those countries are pretty close to what is happening today. It's only that we're keeping record of who is dying every day. We know the average citizen doesn't keep a record of who is dying every day, and we don't really know how many persons die in Guyana every day. We have to call the Bureau of Statistics or something to find out. But I am certain that there are more people dying in Guyana every day than are dying with this condition, this the state of things that we're in right now. I am certain, I'm quite sure that more people are dying every day in Little Guyana than persons who are dying now with this so-called coronavirus. So I am just kind of boggling my mind here to see really what is happening. Maybe most countries are paying more attention to the death of persons now. Of course, persons are being tested and they're positive readings, and persons are dying, as a result of the effects of the coronavirus. I'm going to use the word because you need to hear it. It is just that now we are paying more attention to who is dying and how many are dying and all of that. And it just so happened that it's happening at a time when we are faced with this crisis of the COVID-19 coronavirus, all right, or corona epidemic. It's an epidemic, right? That's what it was termed. I am looking at our numbers in Guyana, and we are doing fairly okay so far. Don't take it for granted. Don't get careless. Stop acting as if nothing is going on, because there is something that's going on. Take the precautionary measures. Protect yourselves, protect each other. This virus is putting a stamp on much of what I've been saying to you people for years. It's putting a stamp on it. It's like putting the foot down. Say, look, wash your hands. When you finish using the toilet, wash your hands. When you touch people or you go places, wash your hands. When you go to certain places and you go home, wash your clothes. Wipe your shoes, wipe your feet. Leave your shoes outside. Don't take things in your house that you don't know what's under your boots. All of those things. You have a pet, your pet goes and he walks around and comes in and jumps on your bed. You don't know what the pet brings on your bed because he don't wear shoes. We talk about all of these things for years. I talk about stop shaking hands because you don't know where that person's hand was before it came into your hands. We talk about those things for years. So now we have a situation where something breaks out and everybody's being told, wear a mask. That one I wasn't telling you to do, but I've been saying it to you recently that you need to put a mask on because, number one, you don't know if you have it. Number one. Number two, if somebody has it and they come and talk to you, you can pick it up because it's transmitted that way. Droplets and so, right? Number three, it's in the air. Don't let nobody fool you. It is transmitted also in the air. Okay, we just don't know how far and where in the air, but it's in the air. That is why they're saying now all over the place almost, all over the world almost, wear a mask when you're in the public. When you go to the supermarket, put on a mask. When you go, put on a mask, put on a mask. That's all you need, put on a mask. You probably can't even find a mask now in the store. You can't find a mask now. And this should be something that we may not want to stop doing after this thing is passed. You want to keep wearing masks because people do have problems that are transmitted all the time in the bus, in the car. It is making people become more responsible and more hygienic, if I can say that, right? You're wiping your car handles. We talk about that for years. We talk about taking your vehicle to the mechanic and you don't even know what the mechanic had in his hand, and he holds your steering wheel and he holds your gear shift lever. We talk about all of those things. He sits in the seat. For years I'm talking about those things. You folks who've been following me can tell you know that. Right? So this is not new that you need to protect yourselves. You need to protect others. You need to do it. Why? because you don't want to transmit anything to someone else. Not unless you're doing it intentionally. And even if you are, it's wrong. You shouldn't do it. So we need to develop and cultivate those habits of cleanliness in every way. You're going to road with the shoes, don't walk into your house with it because you don't know where you mash. You got cat dung, dog dung, cow dung, fowl dung, donkey dung, everything dung on the road. And you want to walk on that road with the shoes, and then you want to walk into your house with that shoe. You don't know what you're carrying in there. People spitting on the road, they're peeing on the road. Some of them even messing on the road. Dogs are doing it, everybody doing it. And you're walking on the road, right? Because in some places you don't see that. In America, for instance, you don't find no horse on the road like that. If he's on the road, he got something on his butt so that when he poops, it goes into the bag. If you're walking a dog, you have to walk with a bag, or you walk with a bag and a little spade because you got to pick up the mess after the dog. You don't leave it on the roadways. Those are all things that need to happen in Guyana. All them stray dogs that are on the street need to be picked up and need to put to sleep or get the people adopted or something. We have to get our act together in Guyana. We have to. We want to encourage tourism and all that. You can't want tourism to come there. You got donkey dung, cow dung, fowl dung, dog dung, human dung, all over the place. You're walking in the place and you're smelling all kind of things. We have lessons that we need to put into place. We have factors that are seriously breached that the health department and the health ministry need to get serious with. Because even with those simple things that I mentioned, you could spread a lot of germs. You could. You got people pushing baby prams on the road with their babies and so on, and then you don't even know what's been there before. You push your pram on it, and then next thing you know, the pram goes in the car, then the pram goes into the house, and then you're taking stuff in your home and in your cars. We got to start thinking about all of those things. You've got to start doing it. Believe it or not, you've got to start doing it because that is where a lot of things happen and you don't realize it. Now, we are faced with a situation where we have curfews, we have restrictions, we have shortages of all sorts of things like toilet paper and all sorts of things, all kind of things happening. And people are panicking, they're panicking. Why are you panicking? Don't panic. Prepare. Plan. I've always told persons when I speak with them, when I do lectures and seminars and I do one-on-ones and all that, you got to plan for a rainy day. You got to plan for the time when things are going to happen that you can't control. And then when that happens upon you, what do you do? Are you ready? Are you prepared? Listen, you got to plan and prepare like if Jesus is coming and you don't know when he's coming. Right? Are you ready when he comes? That's a question the ministers always ask. Are you ready when Jesus comes? You've got to prepare and plan for anything that comes. Hardship, restrictions. Don't go to the toilet and buy one roll of toilet paper to last you 4 weeks. Unless you're just taking a sheet every day, You gotta buy a few packs of toilet paper and put it away. And you practice that, when you put that as part of your grocery bill, toilet paper. So when you don't wait till it finished before you buy another one. It's part of your grocery shopping list. So when you go to the grocery store, you're picking up 2 rolls of toilet paper, even if the other one ain't finished. Don't wait until something runs out before you start replacing it. I know some people are saying, yeah, doc, it's easy to talk about because, maybe you could afford it, but we can't. That's another thing. That's another problem we have. People are paid too little. They pay too little. You can't want to pay people the kind of money that most people are earning now, and they can't even go to the supermarket and buy goods for themselves. You can't do that, man. We have to do better than that. We have to take a serious look at all of those factors. Because if you can't eat healthy, if you can't buy healthy foods, then you're going to have a weak immune system. This coronavirus thrives on a weak immune system. It thrives on a weak immune system. And we've always talked about enhancing your defense. Your immune system is your defense. The only defense you have that can protect you from illnesses, in the most part, besides a donkey cart running over you or somebody knocking you down or something, is your immune system. You want to prevent things from happening to you. Right now, everybody's scrambling for vitamin C. Everybody's scrambling for all sorts of things. I'm going to give you some information that you're going to start scrambling again if you can find it in the supermarket. Understand, a lot of supermarkets are closed, right? And many of them are out of certain things, you know? So we are in a state of disarray in many instances because the coronavirus is on us, right? Persons don't want to sit down on the road corner playing dominoes. Understand? People are still gambling with cards. They're still playing dominoes. They still, you know, you touch a domino, it goes around a circle, another man shuffle it, because I play domino once in a while, right? There's another hand going in dominoes, then you're picking up cards that the other man pick up already. You don't know what you're finding, you're drinking and eating right there. Y'all don't know what y'all doing, you know. Y'all don't know what you're doing to yourselves. Many of you are transmitting diseases to each other and don't even realize it. You're playing cards. It's one pack of cards. You're playing domino. It's one set of dominoes. Everybody have one of them dominoes. Y'all don't think about them things? And they're going to take the same hand and they're going to, the man, you don't know where the man scratch up where he had his hand before, right? Or the woman. If it's a woman playing with you and all that. You don't know where they come from. You don't know what they had before they come there. Right? But yet still you can take that same hand and you're passing around planting chip, potato chip, and you're eating and drinking and playing dominoes. You're doing all kind of things to each other and you don't even realize it. And then you want away and go home and come here feeling good. Stop playing the stupid dominoes and cards and start constructing things that can make a difference. Yes, once in a while you can play and have a little fun. Nothing wrong with that. But some of y'all doing it every damn day. Every day you sit down at the domino corner. There's a special place you go and play domino every day. You're playing cards every day. And you're talking shares, chipping this on the domino table. Nonsense. Nonsense. Some people play domino and they're talking about things happened 40 years ago. You're bringing up the dead when you sit on the plane. Yeah? There's some people who don't like to sit around the dead. They don't want to hear nothing about the dead. But you're rehearsing the day that happened 40 years ago and it's only now and it's 40 years later. Come on, man. Get constructive and start thinking about things and saying things that can make you better, that can enhance your country and your life and your family and so. Talk about things that make sense. Nothing wrong making a few jokes and so, but don't live in the past. Learn from the past. Learn from the past. You know, I had some friends I used to go to and I would play once in a while whenever they're there. I stopped going because when you go there, it's sheer nonsense that come up 40 years story to bring it up. I don't want to hear them things. I don't have time to sit down and listen to garbage. You know? Nonsense, man. Nonsense. Nonsense. Let me send a text here. Somebody just send me a text or something. You know, we need to start. We need to progress, not regress. Progress. Say things, do things, make things happen that can take you further ahead, not behind. Not behind. The coronavirus is here. This is like a cleansing that's happening. It's a cleansing and a reminding you that you need to do certain things. Cleansing because some people are going to be taken out. Okay? Now let me say this. This is Easter weekend. I want to wish you a happy Easter. Okay? Tomorrow's Good Friday for all of the followers of Christ. This is the crucifixion weekend and resurrection weekend, right? Just remember what the season is about. And the congregation is not a congregation anymore like it used to be because of this condition. You can't congregate. You could still celebrate, okay? Now I want to say something that this program is also on YouTube, so you could tell your friends. So you could go to YouTube and you could find this program. All right, and you can't get it live on YouTube. at the same time because it has to be uploaded. So maybe later on today you will find it on YouTube. Okay, so you could, if you miss it and somebody can't see it, then you could find it on YouTube. Um, my operator is going to put it on the television there, how you could find it on YouTube, so you could find it. And I want to also say to those persons who have appointments scheduled for next week, we have appointments that are scheduled, right? We take persons by appointments for the most part. Some people walk in and they find us and we help them, but for the most part, it's by appointments. What needs to happen is that you can call the clinic. Okay, we are doing things remotely. You can call the clinic and you can still be seen. Okay, you can still be seen, you can still be screened, right? You just have to call the clinic at the number that is going to be on the screen, the 231-6477 number. You can call there, and don't call today, right? Call in the morning. Don't call the number now because it's not a live program there. It's a remote program, live but remotely. So don't call the 231 number. We're going to put the number up for you to call just now. Okay? But you call and you leave your name and the number, and one of the persons there will call you back and make a schedule for you to have done what you need to be done, what you want to have done. Okay? That will happen. So you will call that number and you will leave your name and a number, and then you will have a return call, and an arrangement will be made for you to see me if that's what you want, or to obtain what you need from the, if you want to get your medicines refilled, then that is also possible to be done, right? That can be done by the appointment, by calling and leaving the number and your name, and that's going to be done. All right. So it's Easter weekend. And it's cross-bond weekend. I normally would give out the formula for cross-bonds, but I ain't gonna give it out today because you're supposed to have it by now, and it's available all over the place. So you're gonna make your cross-bonds still. Don't be afraid. Make your cross-bonds and enjoy your Easter weekend. Okay? I had someone send me a whole pan of cross-bond this morning by mail on WhatsApp. Took a picture and sent a whole pan of crossbun to me, and they looked so nice. I can't get no crossbun because I'm not there to get it, right? But make your crossbuns. The problem that we have this weekend is the kite flying thing. You know, I feel, I don't know, it probably will still happen, but it may happen 6 feet apart from each other, which is probably good for the kites anyway. And then you have to wear your mask, but that's not my call. That's the authorities who will decide how that kite flying thing will happen. But I don't think we should deny ourselves the fun of Easter and the purpose of Easter. I don't think we should deny ourselves of that. You know, work it out and find ways to still enjoy your Easter weekend and make your cross buns and so. All right. Now there's a serious input about a particular medicine, hydroxychloroquine. Now, this medicine, they say, works well with the coronavirus. Okay? Now, this is a prescription drug, and I know we have it in Guyana, but I want to make you aware that this is nothing more than that synthesized quinine, right? Synthesized quinine, or quassia. Quassia. Quassia is the bark that the extraction is taken from to actually make this medicine, quassia, right? But quassia is more than just something that could be used for corona. Quassia is used for malaria. Quinine is used for malaria. So they're saying that the malaria medicine works with the coronavirus. It has helped a lot of people indeed. But the quinine or the quassia or the hydroxychloroquine, as they say, is the same medicine that you could find in the raw state of the quassia bark. It is more natural that way, and you will probably get the same results, right? It is used for more than than just that. It is used for lots of other things. Okay. Um, it is also found in Canada dry tonic water. Canada dry tonic water. The Canada dry tonic water has quinine inside. It is in there. Canada dry tonic water. Don't go and clear the shelves out now. It's there somewhere. Not everybody have it in Guyana, but it's there, and you can get the same benefit pretty much by using the Canada dry tonic water. Okay, it's like a preventive measure, I guess. You know, and if you be tested positive with it and you're home in quarantine or something, and you're in quarantine, if you get some of that and you take it, it will help you, right? But again, it is the immune system that you've got to build again. It's the immune system that is fighting everything. Okay, now on this program, today we have some videos I want to show, and I'm going to ask my operator to start. There's 4 of them, I think. We're going to try to get them all in, and I'll take some calls. I'll ask her to show one of the videos now so you could have a look at what's happening out in the other side of the world.
I'm Dr. Emily Porter. I'm a board-certified emergency physician in Austin, Texas. So I'm also happen to be the sister of Katie Porter, who's a representative in Congress, who about a week ago made national headlines for her whiteboard. Right now, we're in the middle of this coronavirus outbreak. And everyone is really confused because they don't understand why are the bars closing? Why is everyone hoarding toilet paper? And what does social distancing mean? What does flatten the curve mean? I'm going to show you on my whiteboard why doctors, governors, and other people around the country are concerned about coronavirus and why every American should be. And really everyone around the world should be. So numbers-wise, in America, we have 331 million people. So the CDC is estimating that about 40 to 70% of them will get infected. So to make the numbers easy, I'm going to say that it's 150 million people. That's about 45%. So on the lower end of that 40 to 70%. So if 150 million people get infected, 80% of them are going to be just fine. So 20% of people will need hospitalization. Italy has a big problem right now, and they don't have enough hospital beds for people. Well, they have more hospital beds per capita in Italy than they have in America. So 80% fine, 20% need a hospitalization. 5 to 10% of the 150 million that get infected are going to need a ventilator, life support. What it does is it helps their lungs rest, it helps their heart rest, it gives their body time to heal, because we don't have a cure for this virus, we don't have an antiviral drug that works, and we don't have a vaccine. Let's say 5% of the people need ventilators. 5% of 150 million people is 7.5 million vents needed in America. So I start thinking, well, how many do we have in America? Like, I'm in Texas, it's a big state, we've got a lot of big hospital systems. We probably have more than enough to take care of everybody. So I looked it up, and in Texas we only have about 4,000. And so America-wide, we have about, they estimate between 72,000 and 120,000. We're going to say we have 150,000. So let's say we have 150,000 vents available in the country. 0.02% of people could get a ventilator if they needed one. 1 in 50 people who need a ventilator can get one. That means that 49 people out of 50 are going to die. That is scary. That should scare you. That scares me. That should scare everybody who can understand basic math, including my second grader, that 1 in 50 are bad odds. So what that also means is that the doctors have to choose who that 1 in 50 is. Can you imagine? Can you imagine if you had to say, oh, I'm sorry, you have had cancer before, so therefore you don't have a perfectly clean bill of health, so you're not worth saving. Can you imagine saying, oh, I'm sorry, you're 80 and I've got a 30-year-old that needs the ventilator? Making those choices, because that's what they're doing in Italy right now. Unless you want somebody to decide whether you're worth saving, or your dad, or your sister, or your baby, or your grandma is worth saving, you have to do your part to prevent us from having to make these decisions, because we're heading there, and we're heading there very, very quickly. So you've heard about flattening the curve. This is what that curve means. The number of cases of coronavirus, if we don't do anything besides just what we've been doing, if we follow other countries' leads, it's basically exponentially growing. It means it doubles to triples every 2 days or so, roughly. And this is the healthcare system capacity. That's a line. If we don't do anything without protective measures, we're going to end up here, above the ability to take care of everybody. What that means is that all these people, and probably more, die. They die because we don't have ventilators for them. And we have to start playing Russian roulette of who's going to get saved. We're practicing social distancing. We're not going out of the house except to the grocery store to go for a walk. Those are the protective measures, as well as hand sanitizer, washing your hands, covering your cough, sneezing into your elbow. I get it. Like, it stinks. My spring break got canceled. My kids are devastated. I don't want to homeschool children. I work full time. I'm not saying it's ideal, but it's what has to be done, the experts are saying, to prevent this from happening. There's a million reasons to be angry and unhappy and just think that this whole thing sucks, because it does. But what really sucks is losing 47 million people. So I'm washing my hands, I'm doing my part, and I'm also just listening to what I'm being told by the experts, and I really hope that you can too. This is about everybody coming together for the common good, that we want a future for our children. And it's 2 weeks, man. It's like 2 to 4 weeks. And I hope that if you care about anybody other than yourself, including especially these 47 million Americans, that you will also do the same and just not complain about it and just do it. Because
Hello? Okay, I hope that you would have learned a few things there, and you would have gotten a better picture as to what is really going on with this virus and how seriously you need to take it. Wear your protective devices, sanitize. Don't play with that. Talking about sanitizing, I was looking today, all sorts of things are going to come up, my friends, all sorts of things, but there's nothing as good as washing your hands with soap. Nothing as good as that, okay? You can make your sanitizers, you can buy all sorts of things, but nothing as good as preventing contamination and washing your hands with soap and water, all right? I saw today that they have a portable UV ultraviolet sanitizer. I guess you will just pass it on your hand and whatever, and everything should be good. Again, wash your hand with soap and water and avoid making contact unnecessarily, right? Never mind those things. Now, I have several other videos that I want you to see that can really benefit us all. And because of time, we don't have much time, and then I want to take a couple of calls. I'm going to ask my operator to show the other one that is queued up, so you can get more lessons and more information. And some of you may have already gotten some of this information, but it doesn't hurt. You may have missed something that you will see now. So queue up and you stay tuned. I'll be back in a little bit.
Concerns at grocery stores now that some workers have come down sick. We wanted to know, how long can the coronavirus survive on food packaging, and does it stay on packaging that's in your refrigerator, or does being in the cold kill it?
Yeah, good question. Consumer investigator Chris Kamara and his team set out to get some answers. Yes, does the coldness in the refrigerator kill the virus?
No.
Oh.
I think everything's going to change for me going to the grocery store from this moment forward. Well, actually, a couple hours ago. But all right, here's the thing. The virus might actually live for a few weeks in our refrigerators. Today, one of the world's top virologists at the Gladstone Institute in San Francisco recommended to us that everybody wipe down every box, bag, bottle, and can that comes into your home from the grocery store, especially products that go into the refrigerator. And here's why. We're talking about a 2010 study by the American Society for Microbiology. They found that the SARS coronavirus, remember that, SARS, well, it's very similar to the COVID-19 virus. And when they looked at it, they found that it thrived in an environment identical to the one that your refrigerator reliably creates, specifically one with low humidity and a temperature around 40 degrees or perhaps a little colder. In those conditions, researchers found the virus lived up to 28 days. 28 days. That's almost a month. We asked Dr. Warner Green, what you should do with food packaging during the pandemic.
The point is that you would never put anything into your refrigerator without first decontaminating it. For foodstuffs and boxes and things like that, my wife and I do this together. A towel, soak it in the Lysol, and then really go over the hard surface of the cardboard, of the food product, etc.
All right, we know disinfectants are tough to find right now. They're sold out. So here are Dr. Green's alternatives. Use diluted bleach, 1/3 cup bleach for 1 gallon of water. Or in a pinch, just warm, soapy water. Dr. Green says soak a clean towel in your cleaning solution, wring it out a little bit, and then give every box, bag, and container a good wipe down. All of this, by the way, applies to dry goods for the pantry too. And when you are done, this is really important, wash those hands 20 seconds. Sing happy birthday twice. Dr. Green says the risk of getting COVID-19 from food packaging is low, but taking extra care might give you a little more peace of mind. He says he's wiping everything he gets from the grocery store down, so maybe we should be doing it too. I will. We're taking questions about the coronavirus every day. Please submit yours at nbcbayarea.com.
And you see, it's not strange that these things are being revealed to you again and again and again, right? How many times have we talked about that? I remember distinctly talking about when you go to the supermarket and you buy things, and you know you have you pick up a bag and you put your goods in the bag, and you just take the bag home, and you don't know what you took home in the bag. You don't know what you took home in the bag. There's something could have been in that bag that you don't even know, and you put it in your house, right? Be more vigilant, be more aware, be more conscious of what you're doing. When you go to the supermarket, I don't care which one you go to, and you pick up something off the shelf, do you think that that thing just dropped on the shelf by a robot that put it there? Maybe at some places. Do you think that it just accidentally landed there? No, someone had to put it on the shelf. Someone had to put it there. When you buy that chicken or beef or whatever you buy, you think that it just automatically ended up in the refrigerator, packed that way it packed, or the freezer in the supermarket? No, someone had to hold it. Someone had to hold it and guide it through some machine. Someone had to hold it and cut it. In Guyana, we don't know what happens there because we are so backward in many ways. You know, someone we don't even know what kind of water they use to wash things, and we take it for granted and we just take it home. We put it in the fridge. You see where that virus can last for over almost a month in your fridge, in your freezer. That's in your freezer, much as your fridge. In your freezer, it's normally much colder than your fridge. It's ice, it's frozen, and it will last almost a month in the freezer. What do you think is going to happen in the fridge that's not as cold as your freezer? You know, we've got to be thinking, folks. We've got to put on our thinking caps. You know, when you buy things in the supermarket, or I don't care where you buy it, you need to make sure you sanitize it. You need to take at least 2 ounces of bleach or something like that, or two cap full of bleach and a gallon of water, and you wash things out. You sanitize it. You take a rag and you wipe your things, wipe your fruits, wipe your vegetables, wipe your tin stuff, wipe your everything, your bags before you put them in your cupboard. You wipe them because you don't want to transmit something from somebody's hand into your house. You want to minimize it. You can't be perfect, but you can't be too careful. Okay? Now we have a very interesting video that I want you to see. This is about a patient who survived this virus, and I told you last week about my brother-in-law who had the virus, and I was able to guide him through the process, and he's okay today. He's fine. It happened again today with a lawyer from Guyana who's in New York, and the family had the virus, and they just happened to know someone who knows me and knows where I am and had my number, and they called me. This is no joke. They called me and I was able to guide them through the process of what to do from here where I am. And they've employed it, and believe it or not, it's working. It will work because it will work. You know, he's amazed at the quick time, how short of a time it took to have the temperature of his wife, which was 1 week she had 104-degree temperature fever, and she had the virus, and she still has it, and the fever wouldn't go. And within 24 hours, based on what I told him, the fever was broken. He called me this morning. Doc, the fever is broken. It's now 98. She's now 98 from 104. And he can't believe it. It's so simple, and he can't believe it. You know? So some things that are maybe simple are too simple for some people to understand that they can work for you, right? But I want you to pay attention to this one because this is serious. Take a look at it.
Good morning. It's 30 minutes past the hour. We're going to say good morning together now to a guy in Ohio in his hospital bed because he's being treated for the coronavirus right now. Now, at first he said, I didn't think I would survive.
Protect yourselves. Do not go in the crowds. Do not shake hands. Stop hugging each other. Wash your hands continually. They don't know how I got it. No one in my circle has been sick or exposed.
Kevin Harris is joining us now. Good morning from, I think, St. Joseph in Warren, Ohio. And Kevin, at least you have the breathing apparatus out of your nose. How you doing?
Oh, I'm doing great. I just found out 2 days ago I'm gonna live. I'm actually excited.
We're excited too. Was it that bad? Were you touch and go?
Oh, no, it wasn't touch and go. It was all go. It was bad.
Did they tell you in what critical condition did it put you in that bad of a condition? Why don't you tell me about how you felt, Kevin?
Well, actually, I run an elliptical for an hour every day. And my diet is really strict. I don't drink. I don't smoke. I've never done drugs of any kind. I'm super healthy. Even my heartbeats per minute at rest are 40 beats per minute.
Oh, wow.
So I'm in pretty good shape. And the virus was like, oh, I'm going to fix you. You think you're healthy? Let me show you what I can do to healthy people. And it started turning my lungs to glass.
That is such an incredible way to describe it. Go ahead. Go ahead.
The more I rest, the sicker I got. And it's really weird because it lets you feel better when you lay down, when you breathe slow. But the whole time, your lungs and your body is defeating the whole purpose. You start to turn to glass and it crystallizes and more of your lung capacity is taken away from you. But when you get up to move, your air drops to half, your air consumption, you choke, you throw up, the pain, the headache, everything comes back when you move, but that's what keeps you alive. It helps your immune system to fight back. But the virus makes you feel good about laying down. It's almost like a high because you get this feeling that I just want to lay here forever. But you know if you breathe, you're getting less and less and less oxygen, and sooner or later you're going to go into respiratory failure and cardiac arrest. So
they make you get up then?
Oh my God, yes, they make you get up. And when they make you get up, you throw up, you cry like a little baby. And I can remember the first time it happened. After I threw up, I could breathe. So the next time around, I tell the nurses, no matter how much I beg, do not lay me back down. Make me go through it. It takes about 20 minutes to go through one of those episodes. But once you get to the other side of it, you can breathe a little bit better. I mean, it's the weirdest thing. You think you're gonna die during one of those episodes. You know you're gonna die, but then you don't. When just the opposite, when you lay in the bed the fever goes away, the headache goes away, the body pains go away. You feel this relief come over your whole body, and it's killing you.
Wow. Kevin, I have never heard anybody explain these episodes as well as you just did. Now I can see why there's such panic and alarm about ventilators and why people need ventilators and they're afraid they don't have enough in the hospital system in the United States. Did you have to be on one?
No, they did everything they could to keep me off a ventilator. And that's, another one of those misconceptions. I know they're only trying to help and keep people from panicking. But if you don't breathe on your own and your immune system does not kick in, you are going to die.
Kevin, I think that your words can be a big wake-up call for a lot of people who might be gallivanting around on a beach or, out saying, oh, I'm young. You got some advice, I bet?
Well, I'll tell you this. I didn't know I had the coronavirus. I thought I had the flu. Even when I came in the hospital, every doctor in this hospital said, you don't have the symptoms. It's not that bad. It doesn't go this way. It doesn't go that way. You have some very, very bad pneumonia. Until 3 days later when the test came back and they're all sitting there with their mouths open like, we don't know what to do. When your doctor says to you, there's nothing we can do and you need to pray and beg God for mercy. I never heard a doctor do that before, but I heard that in this situation, and I thought, that's what I said. Are you actually saying this to me? And it came down to one of those moments of truth where they can either lie to you or they can tell you the truth because one day they got to see God too. And that's what it came down to. No one could tell me I was going to live.
Are you St. Joseph's first coronavirus patient?
Actually, I am, and I'm the first one in our valley in the county. And the thing about that was I own a body shop and construction. We do a bunch of other things. So I see 30 to 40 people a day, most of which I've never met before. But because I'm so, public and such a major public profile, I tend to find times to be alone for days at a time. So it just so happened that 10 days before I got sick, I hadn't spoken to anyone closer than 7 or 8 feet. And most of the places I went out of town, so people didn't know me, so I didn't have to talk to people. I was just in a Kevin mode, and I didn't want to be bothered. When I got sick, my son was coming home from school for spring break. My employees wanted to come over and check on me, and I wouldn't let anybody in the house. I kept telling them, you cannot come in here. Whatever I got, it is bad, and you don't want this flu. Because the doctor saw me for 30 seconds, and no test, no nothing, said, man, you got the flu really bad, and gave me Tamiflu and sent me home. And fortunately, that was the only place I had gone to. Now, the killer of all that is that law thing. I kept laying in the bed because I felt better when I laid still. And then one day I realized I'm not going to be able to breathe the next time I have an episode. And they got me to the hospital. And then, like I said, 3 days later, I got the coronavirus. No one thought I had it.
And it felt completely different to you. Isn't it strange how some people report, oh, I just had a sore throat, a bit of a cough, while other people like yourself, an exerciser, only 55, it has you in a hospital bed. Kevin, what are they telling you right now? How long may you have to be there? You've been there 11 days, I think. How are you now?
Well, to be quite frank with you, yesterday they said, there was nothing that we could do for you when you got here, so you're getting better and you're not on oxygen anymore. So you can go home and ride the rest of this out. You don't have a fever, haven't had a fever for 3 days. The problem is they said you have to be in total isolation, but you're not strong enough to walk. So somebody has to take care of you. I'm like, what? How do I be in total isolation, but somebody has to take care of me? And then I said, how do I get home? Oh, we're going to call you a cab. Okay, so you're going to call me a cab? Who's going to drive the cab? My kids aren't going to come and get me. I'm not letting them anywhere near me. And, well, I asked them, are your kids going to take me home? They looked at me like I was stupid. So now, you know, we don't know what we're going to do. I do know that until I test negative, they're going to have to pull me out of here kicking and screaming and just throw me out of the hospital, because I was lucky and fortunate that I did not expose hundreds of people that I normally see during a week to this virus, simply because I wanted to be alone. So God had me in that mode where I just wanted to be alone for a while, but it saved my community. And now you want to throw me out there. I haven't had a negative test. I've actually had 5 tests. The first 3 came back bad. The 4th one came back, and then they did a 5th one 4 days ago. And when I asked for the results, they said, well, the CDC said we took it too soon, so we don't have any results, but we're going to send you home. And like I said, now they're trying to figure out, how do you send me home to total isolation, but I got to have somebody take care of me because I can't walk?
You know, that might be the first time that a complication like that has been illuminated for us, and that is, are you strong enough once you have this to go home, but you have to self-care as well as self-isolate, and that in itself, for many people's conditions, will be a contradiction. Kevin Harris.
Exactly.
And Kevin Harris, who's joining us right now from his hospital, but I'm telling you, in Warren, Ohio. And he also wanted to point out, too, that he hasn't gone to exotic places. He went to Cleveland. That's as far as he got. And somehow it's come down with coronavirus. Hey, Kevin, how are you passing the time?
Robin, I am so sick, I do not care.
Got it.
I don't care if I sleep in the dark. I don't care if I be alone. You know, one thing is that the healthcare workers are those, I mean, you talk about heroes. They come in here with smiles. They have children. They've even got people in the community ostracizing them for taking care of me. And these people are risking their lives and the lives of their families, but the community is rejecting them because everybody's scared of the virus. I've never seen anything like it. And yet
let's
they
not
still
do that,
keep
right? They are the
coming in.
heroes.
Yeah, and they know what I've been through. Imagine, they don't want this, but they've had to listen to my story 100 times, how it takes me an hour to get to the bathroom. My bathroom is 50 feet away from my bedroom, and I'd have to go 10 or 15 feet and lay on the floor for 20 minutes to catch my breath and then continue to the bathroom. I mean, this is real. And this is one of the reasons why they don't want to send me home now, because they already know I went through 6 days where I crawled to the bathroom or I made a ham sandwich on the floor of my kitchen because I couldn't get up against the counter and the table to put Miracle Whip on my sandwich. I ate my sandwich on the floor with my employees standing outside the door begging me to let them in the house. And I told them, no, they can't come in here. This is bad, Robin. It's going to be really bad for a lot of people.
Kevin Harris, we are all ears, and we're all hope for you, too, that you continue to get better. I'm going to ask our producers to keep in contact with you. If we can send you right now a mental get well card, we all are. And Kevin Harris, what a strong guy. Hey, you know what I'm really grateful for? Your voice, your diaphragm, your breathing. You sound healthy. Your voice is strong. And for that, Kevin Harris, we are so grateful. Thank you.
And my operator, we're doing this.